Hello! Just kidding. Two pharmacological agents that are used, or two types of pharmacological agents that are used to treat hypertension in people in New Zealand. We have beta blockers and calcium channel blockers. The beta blockers, we have atenolol. Mylan atenolol is the alternative name for that particular type of drug. We have carvedilol, alternative names, dilatrend, carvedilol, and dicars. Both of these types of beta blockers, they serve to reduce cardiac output of the heart. That means that they reduce the contractility, how hard the heart can contract, and the rate at which the heart can beat. So it essentially slows down the heart or reduces the top end of the heart. And by those two mechanisms, reduces the overall output, or how much blood the heart can pump through to the rest of the body. They also reduce the peripheral resistance in the body by vasodilation, so that the capillaries are opened up through the rest of the body, so that there is less resistance for that blood being pumped through the body. Cautions for massage with beta blockers. There is a potential for dizziness. So if you've finished your massage, what I would be considering is if I'd finished the massage, and they're getting up off the table and they feel a little bit dizzy, I would get them to sit back down again because, sorry, I thought something just happened to my screen, because they may be experiencing the effects of orthostatic hypotension, meaning stand up, feel a little bit dizzy because the blood pressure isn't sufficient to supply the brain, and so we just have them sit down again for up to 3 minutes just to wait for that dizziness to dissipate. They also can be drowsy, so you'll be a little bit sleepy during the massage. If that is the case, if they're not rousing, we can use some more vigorous techniques just to help bring them back up out of their relaxed state that we hopefully have brought them into. Medication is kind of self-explanatory, it's just a tablet. The quantities there are quite self-explanatory as well. With time we've got, I won't go into that too much. Both of them have the potential to raise blood glucose levels, so we need to make sure of whether or not they appear to be high in blood sugar. They can be tired. Headache is another side effect of beta blockers. So if they're experiencing headaches and they've come to me for massage to relieve our headaches, I will need to inform them that massage may not be the best method for achieving that result because it might be drug induced, and therefore they may not get the result that they want for headache relief. So just so long as that I need to make sure that I inform them of that. They can experience nausea, so I would have a spew bucket handy, or have them with easy access to the toilet so they can use that and get themselves cleaned up should the worst happen. There's also tightness of chest and wheezing. So if they're experiencing tightness of chest, I may look at a modification for being on the table, so that I may have them on their side, or I may even put them on a massage chair that I have down at the clinic, just so that they're not lying on that chest and compressing and trying to breathe through a little hole while they're experiencing this tightness in the chest. Also, swelling of ankles or feet is pretty prevalent through a lot of this medication. If they were prone or supine on the table, I'd be looking to elevate their legs so that it will assist with natural gravitational draining, and I may even consider, if they want it, doing some mechanical draining as well to help them with that. A consideration on that is that we'd want them to have also easy access to the toilet should they need to relieve their bladder from that draining. Okay, moving on to calcium channel blockers. Again, like I said, there's a lot of them. We'll go through all of the names first, and then we'll go through a few different parts to do with them individually. So, amlodipine, alternative names, apoamlodipine, amlodipine, oroamlodipine, and Norvax. Next category we have diltiazem. Alternative names are apodiltiazem, cardizem CD, and dilzem. Moving down, felodipine, alternative Plendil ER or Phelo ER. Moving down again, isradipine, alternative is Dinocer SRO. Next category, nifedipine, alternative name is Adalat, Nifax retard, Adafin XL, Adalat Oros. And finally, we have verapamil. Alternative names Isoptin, Isoptin SR, and Verapamil SR. Alright, of these calcium channel blockers, they all likewise have the potential to cause dizziness. So again, the same considerations would be needed to be taken into account as with the beta blockers, that if the patient or if the client feels dizzy upon getting up off the table, just have somewhere for them to sit down or sit them back down on the table until that dizziness dissipates, and then there's a reduced chance of them obviously falling. With amlodipine, isradipine, nifedipine, and verapamil, there are breathing issues. So the client can be experiencing shortness of breath or trouble breathing. So we need to make sure that they're comfortable on the table, that there's not going to be any anxiety over the breathing. We may need to modify their position on the table so that they can feel comfortable with their breathing, and that so that there's no restriction to that. As I said, the medication type is fairly self-explanatory. However, I just want to talk about diltiazem and verapamil briefly. Both of these have a fast-acting tablet that they may not be taking on a day as a once-a-day basis. They could potentially be taking it this amount here divided into 3 to 4 times in a day. So we need to be aware of when they're taking it, if they're going to take it before the massage or immediately after the massage, and make them aware of the effects of massage and the interaction of that drug here and here, which will serve to reduce the heart rate and contractility. Again, the cardiac output, as we explained with the beta blockers, reducing how forcefully the heart can contract and reducing the heart rate. So if we've done a massage where we've slowed that heart rate, where we've got them really relaxed, and their heart rate as a result is nice and slow, and then they take a fast-acting calcium channel blocker, they can further exacerbate that result. So we just need to make sure that there's education on their side as well as to the effects of massage in association with their medication. Now, going over the mechanisms of the calcium channel blockers, they all serve to amlodipine causes vasodilation in the heart and the peripheries. And now what that means is that not only does it reduce the resistance through the extremities and through the body and all the cell tissues in that, but also in the heart. So there's less resistance through the through the heart cells, so that it can get so that there's less resistance for the blood supply in the heart. And that is the case with amlodipine, felodipine, nifedipine. Now with diltiazem, with verapamil, that works the same as, in a similar way as the calcium channel blockers, with the beta blockers, that the contractility of the heart has been reduced and the heart rate has been reduced. Apologise if I'm repeating myself, I haven't got a script that I'm following. Now, over to cautions. Again, with all of them, you can get a drug-induced headache, so they need to be informed that if headache relief is their goal, massage may not be the right method for achieving that, because if the drugs are causing it. Again, we're not diagnosing it, we're just saying, look, a side effect is headaches, and if it's drug induced, then massage isn't going to be much help on that, potentially. They all seem to have the potential to constipate you as well. A consideration for massage would be that if they were feeling constipated and they were wanting a clockwise massage motion on the abdomen, clockwise, was reversed for a second there, can help to alleviate the symptoms of constipation. I think I've covered everything. We'll leave it at that. Cut. See you later.